Welcome back in 624 on your Wednesday morning. Earlier this week, President Joe Biden signed a bill terminating the national emergency related to COVID-19. It basically prompts immediate changes to some pandemic-related federal programs.
Our Megan Zielinski sat down with epidemiologist and Erie News Now contributor Dr. Becky Dawson to learn more about what this means for us here at home.
Dr. Dawson, you've been with us now for over 3 years, working on during this entire pandemic in this COVID world. What is your initial reaction to seeing Biden lifting these restrictions?
I think it's about time. And we really have learned how to prevent, diagnose, treat, and help people recover from COVID. I think we also have seen over the past year that, really we've only seen Omicron and the subvariants of that virus or that variant of the virus. And I think that that's really important to note that, yes, the virus is still evolving, but these big changes in the viral genetic structure aren't happening anymore. The virus is doing what we expected. It's becoming more transmissible, less virulent, because it just wants to spread to stay alive. And we really do have a lot of knowledge. We have a lot of tools at our disposal, and ending the emergency is appropriate. It doesn't mean COVID's gone, but I think pulling back and saying this isn't a public health emergency any longer is the right decision.
And by ending that emergency, is that changing anything that what's happening in the hospitals or with the healthcare field as of right now?
It's not going to change how you're treated or how you're diagnosed or, can you get Paxlovid, those sorts of things. No, none of that is changing. Does it change that you'll probably be sick for a couple of days and should wear a mask a few days after you've been diagnosed? Doesn't change that. So I think the most important thing to know is a political action does not end the spread of a viral disease.
Dr. Dawson stresses that although the emergency has been declared as over, you can still get sick.
Yeah, so we should all, she says, continue masking and social distancing when we're sick, as well as practicing that good hand hygiene. I don't think that's ever going to go away, at least not at this point.
Think so.
All right, I do want to get you outside, taking a live look at the